All right, guys, episode 3. I'm pretty excited about today because we got one of our favorite people in the CrossFit community who doesn't actually do CrossFit. Derek Stratton, chiropractor and owner of DNA Chiropractic right here by the box. We've got tons of people that go there. You go there, I go there. Everybody here goes there just to kind of keep us healthy and stuff. And we're really going to talk into a lot of that. But I kind of wanted to first start off with just getting a little bit of history about DNA.
Sure.
When you opened here, when you came back to Louisiana, just a little story.
I'm a 1998 Hollandville grad and super
Tigers.
Excited by the Tigers in the Dome this weekend, representing our hometown. Met my wife in pharmacy school, and both of us were in pharmacy, worked at the Poison Control Center, and just realized that drugs weren't always the answer. There's a good time for medicine, a good time for surgery, a good time for chiropractic, and there's always time to exercise and have nutrition. And that's really what we push with our practice, is trying to stay healthy, staying on the wellness end of the health spectrum, not sick care, but wellness care. I've heard some experts in the field call it Prehab instead of rehab.
Yeah.
You don't
Pretty
wait.
Sure you just came up with that, right?
Yeah, you don't want to wait
Off
till
the
you're
cuff.
injured. You want to prevent injury by having optimal performance. And so we're kind of structural doctors. We're working more with physics and symmetry, trying to make sure that your body's where it belongs. That way you can run faster, think clear, jump higher, and hopefully outperform the next person. If you're into competitions, if you're just trying to stay healthy, we do that as well. We've got 90-year-old patients. We've got newborns. Everybody gets an age-specific treatment. They say we pop and we crack backs, and that's not really what it's all about. It's about the alignment.
Right, and we're going to get a little bit more into that the further we go on. But just kind of wanted to touch for those that didn't really know that you're just a block down the street, but we're kind of excited. We're really excited, actually. Ray has acquired the room next door, and you guys are going to be moving in pretty soon.
Yes, it's perfect timing. You guys are growing and excelling, and the same thing's happening to us. It's a great year. 2018 is going to be even better. Being right next door is going to offer a lot of people access to stop in before and after WODs, or even by appointment on the weekend if they're really needing our services. We're going to be adding a couple new things in 2018 as far as some pediatric stuff. I know Dara is certified in the kid part of CrossFit, and we're really excited about that because exercise is part of the health equation.
Yeah. Now, just to kind of build on something you talked about earlier, which I totally buy into this, is kind of your mission or your beliefs is that you would rather treat without medicine. I know me personally, I don't even like to take Tylenol or Advil or anything like that. It just, I guess just the thought behind it, and I'm not sure about it, and I just was like, screw it, I'd rather do without. And so kind of elaborate a little bit on that and why you choose to treat without medicine.
Well, it's just natural is always best. You can swallow glass shards and nails, but can you put it in the toilet? And a lot of these newer synthetic chemicals, we have a real problem excreting them or getting them out of our bodies. And if you sprain your ankle or have inflammation, an occasional anti-inflammatory, even a prescription medicine usually doesn't hurt you in short use. But when it becomes daily chronic use, your organs start to have some stress put upon them, and they don't always tell you about it until you have some major tissue damage. And so we are not against medicine. We just think that it shouldn't be your first option. You should have nutrition, and you should be able to use ice and heat, stretching, and things like that.
Yeah, and Ray and I listen to a lot of podcasts, and one of them we listen to is Joe Rogan. And the funny thing is, I listen to a podcast of his, if you haven't listened to Joe Rogan, go check him out. He's pretty awesome. I listened to one recently where they kind of talked about big pharma and stuff like that, and I believe that there probably is a place for some of that stuff. It really does help with a lot of things, but a lot of that is just really to make money, create new illnesses so that they can treat these things and all this other crazy stuff. So anyway, I could get off on a tangent with that, but we'll save that for another show. How about that?
Yeah.
Now, what I want to talk about here is things like Ray and I do when we go over there. Let's talk a little bit about the services that you offer. Let's just talk athletes, first of all, like some of our CrossFit athletes. We'll get into the rest of the population pretty soon. But
Mm-hmm.
what types of things do you offer for?
Well, we are a recently a recent Graston provider. The Graston Technique, you can go to grastontechnique.com. Physical therapists, occupational therapists, chiropractors, and athletic trainers are using it. It's huge in sports. It's actually wonderful with our senior citizen population as well. It's for people that have not or just don't have access to like massage therapy and other services that are also right next door to the box here. So people really don't have to go anywhere else unless they need a prescription, and that may be coming in the future, just depending on which way we decide to go. But with the Graston, with the hydrocollator, basically applying heat, moist heat, warms up your muscles before you do any type of stretching. We don't recommend cold, static stretching. We recommend plyometrics and more kinetic type of activities. You need blood in your muscles before you use them, or you're more prone to sprain or strain something.
And just to kind of interject for a second, I just kind of want to, we say Graston, and we know what that is because we've used it with you, and but some of the people that might be watching are not really sure. Just kind of touch a little bit about what that Graston technique actually is.
I'm glad you asked. I was not terribly familiar with it a few years back, and I got to see it done with the NFL. And basically what it is 6 different instruments that we use to apply leverage to the body to make it easier on ourselves and also easier on the patient to get the muscle spasms and all types of inflammatory molecules like lactic acid out of the muscle belly into the periphery. Lots and lots of water afterwards will allow that chemical to get into your kidneys and then out of your body, so you're ready for the next day with less soreness.
So I totally understand what you're saying, but in layman's terms, like somebody who's watching this.
Soft tissue manipulation.
Sorry about that. Yes, it's soft tissue manipulation. It is very similar to massage. We run these instruments down your muscles and basically break up anything that doesn't want to let go. Muscle spasm is a better word than trigger point, which we hear in massage therapy. But when your muscles in your skeleton don't let go, you lose function. A muscle,
absolutely, you do.
A muscle needs to have 100% of the length to give you 100% of the performance. And the Graston soft tissue manipulation or mobilization will basically go in there and gently massage or scrape, or whatever term you would like to use, to get the muscle back to its resting length, so you have 100% of the performance.
Okay, now one of the great things that I love about you guys is that you don't just go in there and treat us and do crack my back, crack my neck, give me some Graston, but you're also doing lots of teaching as well. So through all of this, I kind of went and researched, and I found these. Correct me if I'm wrong. Is it gua sha?
Yeah.
Gua sha, which is the ancient Chinese or Japanese, Asian, I should say, I'm not sure, technique that
Yes.
kind of this stems from. Is that right?
That is right. There's techniques that have been used for thousands of years, whereas a lot of our medical options are less than 50 years old, especially if it's prescription drugs. And you are correct. There are hieroglyphics in the pyramids that show what looks similar to chiropractic, even though it was only created as a profession in 1895 in this country. But these things are tried and true, non-drug alternatives to getting your body back to where it needs to be. But yes, you are correct. Gua sha, Tai Chi, acupuncture. There's a lot of things that's been happening for thousands of years, and now the science just basically backs up what people have been seeing through their practices for millennia.
Well, one of the biggest things about dealing with your office, your practice, and with us is, so I've been a patient since 2012. D-Rock said we was going to have you in, so I started thinking about the first time I went. It was early 2012, so that's pretty good time span. And what I've noticed is, we refer a ton of people every year, is that most people have a stigma about a chiropractic, and it's kind of plays hand in hand with the stigma that people have with CrossFit. They think our main focus is to create the fittest human beings on the planet, when our main focus is just keeping people out of a nursing home. That's really what is going to happen. That's our end goal. And it's almost the same with you. is that so we have a client that, you know, he's having a hip replacement at the end of the month, but he's done everything he can for the last few years to avoid that, you know. But ultimately it comes down to it. But it's prolonged for three or 4 years until he has to go under the knife, you know.
Yes.
And that's kind of what, you know, I appreciate about what services you and Angel provide, is that, you know, my wife and myself, we come to y'all when we just don't feel good. You know, y'all are our first line of health care, you know, if it's anything from, you know, structural to muscular to, I mean, anything, you know, like, you know, Derek, what you think about this, man? You know, and it could be anything that it's not just your neck or your back, you know, it's, you know, y'all taught us over the years that everything is connected. And I'm a true believer, you know. I send everybody over there.
Well, we definitely appreciate those referrals. The more people we help in the community, the more we educate. And education is very important because the stigma on chiropractic, the stigma on CrossFit is based in really ignorance. People just don't know. And I'm not going to give you an opinion on something I've never tried, but man, a lot of people are sure willing to tell you something and they've never even experienced it.
Right.
It's really just people are waking up to the fact that drugs and surgery are there. They've been there. They'll still be there. It's just after a surgery, you're stuck with the results. With the drugs, pain is very rarely, and that's what I see a lot of people for in this state. We are trying to build more wellness, prehab, as the experts like to call it. But really, we see a lot of back pain. We see a lot of neck pain, but there's so much more. Structurally, when your spine is where it belongs, your nerves function better. There's less pressure on your circulatory system. It can help with your blood pressure. But for the most part, what we're trying to do is keep people from needing these drugs, keep people from needing these surgeries until, if hopefully never, but if we can prolong it. Unfortunately, a person that I played football with passed away from an outpatient surgery. And, you know, we're not going to get into the specifics of that, but anesthesia, surgery, the risk is high. Nutrition, exercise, chiropractic, the risk is low. And so you start there, and then you work your way towards more risky procedures when other things don't work for you. Our diet in America is just void of so much. And is it to get people on medicine, or is it just to make corporate profits? There's a lot of theory and debate out there. But what is true is if you eat healthy foods, not processed foods, but foods, things that come off of trees and grow out of the soil, you're going to have less inflammation. You're going to rehab and recover quicker. And with CrossFit, honestly, a lot of the people are doing better than they've ever done, getting results faster than they've ever done, and it's functional. It's not like I've got a huge bicep, but I can't pick this truck off of someone. Y'all have had a member pick a truck off of someone.
Firefighter.
Yeah.
That was
definitely
an amazing story. And could he have done that without coming here? Who knows? But he came here and he did that. And that's what it's all about, is just living optimally,
And
functioning.
That's the biggest thing, is like, you know, y'all ideology and mission lines up so great with the CrossFit communities. You know, CrossFit's at war with Big Sugar right now. It's crazy to think that, well, how did Coach Glassman say it? It's a simple fix to a complicated problem. You want to feel better, perform better, live longer, eat better, exercise. Like, a lot of people don't want to hear that. You know, we live in a world where they look for a magic pill or a special drink, you know, to solve all their problems, when, you know, if you just eat the right foods and get off your butt for a little while every day, you know, big things will happen to you. You know, you'll live longer. You know, I mean, you see people that are having chronic illness these days at 50 years old, and my grandpa might have been on high blood pressure medicine, and he lived to be 87. You know, like that's. But he didn't even need a TV in his house. Like, he was always outside doing something, always moving. You know, and it's scary to know that we're the generation, and it's my generation, that it's not the norm for them to be overly active or
too sedentary.
That's right.
And, that's why this is such a wonderful thing, because it used to be in our lifestyle. And since it's not anymore, we have to add it. And the people out there that think that chiropractic or CrossFit is not affordable haven't really priced disease. You haven't really priced cancer. You haven't priced arthritis that could be prevented from moving. If you don't use it, you lose it. And when you get in here, you're making an investment in your health. It's not an expense, it's an investment. It's 5, 10 years, 20 years down the road. What you do today is going to determine how you feel then. And it's never too late to start. Tomorrow never comes. These people need to get in here now. They need to start now, because heart disease is the number one killer of Americans. Cardiovascular exercise, CrossFit, it literally can save your life. And if you've never had someone in your family on blood pressure medicine, you're probably not American.
Right.
It is so common. Obesity, all of this, depression, all of it, the answer is exercise to all of it. And you exercise better, you feel better with nutrition. We believe with chiropractic, you don't have to have the osseous chiropractic where you're getting cracked. We do decompression. We do E-stim, where we can, again, treat the muscles that pull the bones crooked. It's not just come in here and wham, bam, thank you, ma'am. Some people may practice that way, but the fact that we started in pharmacy, the fact that we have been educated at 2 different chiropractic schools, there's a lot that we can offer. And it just doesn't happen as quickly without exercise, and that's why we're so glad to have y'all next door.
Well, and the big stigma too is that people believe, because look, I preach it, I know E-Rock refers people. Anytime anybody has any ailment, I tell them, hey, just go see Derek and Angel. Even if I know it's probably nothing to do with, structural spine or whatever, you're going to have an opinion that's greater than mine just because of your education and background. But the stigma is that, oh yeah, y'all go to the chiropractor because y'all get hurt doing CrossFit. Well, I can tell you right now, I'm not injured right now, but I'm probably due to go see y'all just for maintenance. It's just to make sure everything's aligned right, And so many times I've gone over there once a month or whenever, and just to get aligned, and then you'll move something, and I'll feel more circulation come to my hand or my foot, or I'll get some relief in a hamstring where, I'm thinking it's just muscle soreness, but it's something that I could never diagnose myself. It's just alignment, And then the fact that it's going into newborns and children is coming in the future, And I've even read on pet chiropractics, So it's not just for the people that are injured in a car accident or whatever. It truly is preventative maintenance for everyone.
Well, and I tell everyone on day one that there's 3 types of stress. There's emotional stress, again, depression, anxiety, chemical stress. Pain is really one of those 2, but they can both magnify pain. Pain is usually from gravity. It's uneven distribution of weight. Over time, it makes uneven calcium distribution, also known as osteoarthritis. And when you can slow that down, you immediately see gratitude. You immediately see people realizing that they can own their health. They are the captain of their vessel. They are not some weak person. They have been taught that. They've been taught that they were lacking these drugs and these chemicals for a long time. When you watch television, all you see are drugs, and then some of the drugs are hurting people. So you just have to be very careful. We like nutrition. If we hurt ourselves, you break your arm, that's when surgery and drugs are excellent. They're lifesavers, and there are some people out there that can't live without them. But the majority of Americans are sick because of their lifestyle. And if they can just learn to change their lifestyle through education, we see night and day differences. I mean, not to say that people are going to pass away if they don't come in here tomorrow, but they are going to shorten their lifespan and what we call quality of life.
Correct.
You can live a long time in a wheelchair, but are you really living?
Right.
And so,
and like I said, that's straight in line with the same things that we preach in here, And we've seen it before too. We'll see 60-year-old grandma come in that can't bend over and touch her toes, and then 90 days she's moving a PVC pipe or a light barbell over her head with no problems, jogging 200 meters unbroken, And when we talk about it and we go back and reflect and say, hey, look, do you remember when you came in here and you couldn't even touch your toes? And it's like, oh yeah, I do remember that, But it's, it's pretty amazing just like you said, and we preach, it's how much difference just eating clean or cleaner. That's the thing is 80-20. Like, we're not telling you every single thing you eat has to be grass-fed and non-GMO, but just try a little bit, get off, prevent yourself from being sick. That's how I like to say it. I try not to get sick, High blood pressure is a form of sickness, and that's like CrossFit, we have the wellness scale, the sick, well, or fit scale. That's how we judge an athlete, whether you're closer to fit or you're closer to sick is, and like you said, just like they teach us at your level 1 and level 2, 90% of America is on the wrong side of well, closer to that sick.
I believe we have one state in America that half of the population is not overweight, and it's Colorado, and that may have changed because I think they got an In-N-Out burger. But, in moderation, like you said, if you give up everything you love, you're not really living too.
That's
but
right.
If you do the right thing most of the time, you can have a cheat day.
Yeah.
You shouldn't try to go 7,000 calories on that day.
No.
But, you got to live too. And outside of here, getting out in the community and just, helping people to learn that they are in control. They're not helpless. A lot of people feel helpless because they haven't been taught this information.
Yeah, and that's one of the things that we provide over here as well as, if anybody has questions about anything, we always tell them, hey, look, just ask, and we can sit you down. We've been doing this for a long time. We've tried different things that work for some, don't work for others. Excuse me. And we can at least guide you in the right direction, kind of get you in the right path to where you can make little changes here and there on your diet, picking different things at the grocery store, getting this instead of that. Some of those just little small baby steps so that we can transform you from, 20 or 30 years of terrible habits in the kitchen to making small changes to where eventually, you're full blown, like you're on MyFitnessPal, you're tracking your macros and things like that, and it really does go a long ways.
And one thing I'd like to say about what y'all do is, again, just to emphasize it, it's for everyone. Unless you can't move, you need to move. I mean, it's for everyone. And exactly what we do over there. I've had patients with broken necks come in. They walk in and they walk out. We're not going to jeopardize your health doing anything risky.
Right.
We understand that everybody's in a specific place, and you get a specific type of treatment there. You get a specific type of WOD here. It can be scaled. It's not, oh my goodness, I have to, do this and I have to do that to be able to participate. You just have to do what you can do, and eventually you make gains, and then you end up in a place you never thought you could be.
And that just stems off of, preventative maintenance and things. We talk about your education and background and things you've seen, your experience. We've had clients go in with, stiffness in their back and everything, and before they leave, you're questioning them about a potential neurological disorder or something, that you can tell just by what you do and tests that you run when you come in, that they may have never known that they had this going on in their body, and now we can really seek treatment, or we can focus specific on things that we can do on this side. Like, hey, your core is weak. This is why you're having this type of pain right here.
Exactly.
Now it transfers to, okay, we have the diagnosis. Now let's treat it, and we treat it with exercise and diet.
Well, people are waking up. They're realizing that change is necessary. I mean, just look at our population. I mean, a lot of our population is a burden on the taxpayer because of the amount of medicine and care they're going to need because of their lifestyle. And so it's really in our country's interest to be able to, perform. And at work, we've got a lot of people missing out on performance at work because the sick days are increasing because, again, they don't change. They don't look outside the box. They need to look inside the box to get to where they need to be. So you got that prehab.
Look inside the box. No pun intended.
Yeah.
So speaking of prehab, let's move on to a couple of things that are hot topics, I should say. Some of the old thoughts versus new thoughts, or just not knowing any better. So into the box, everybody has pre-warm-ups. They have static stretching. They have dynamic stretching. What are your thoughts on the static versus dynamic? Because I've been on both sides of the fence, and you know.
Well, currently, dynamic is being preferred and being looked at as being better. And it really goes back to where's your blood? If your blood's in your abdomen to digest food and get nutrients out of your food, again, you don't want to swim after you eat for a couple of minutes. That's because all the blood leaves your extremities and goes into your core to help you get nutrients out of your food. And if you were to static stretch when you don't have any circulation going, you have some, obviously, but most of it's, doing something else. You need to warm up before you do any type of static stretching, and you do that with dynamic stretching, plyometrics, just air squats, just something to get the blood flowing, limits the chance of you hurting yourself static stretching. When I was in high school, static stretching was it, but that was 20 years ago, unfortunately for me. It seems like yesterday. A couple state championships since then at Hollandville. Hopefully this weekend is one of them. But when you watch, you just have to keep up with the times. A couple of months ago, newer products come out, but a couple of years ago they were saying fats are bad. Fats are very important. There are good and bad fats, like good and bad cholesterol.
Right.
And fat, if you've ever been called fat, it's a dirty word. You don't like it, but it really needs to be looked at in a new dynamic. For neurology, your brain and your nervous system is dependent on fats. And so, for example, if you want to go more natural, instead of taking ibuprofen, we would recommend fish oils. Your omega-3 fatty acids are wonderful for inflammation, circulation, and brain and neural development. And they're very accessible. Used to you had to eat it. Now you can supplement it. And so the static stretching, if it's done in the correct time and place, it can be done safely. But if you're just cold and you go and start pushing or bouncing at the end of it, you're really risking injury.
Okay, yeah, that makes sense, because you've explained it to me one time a long time ago that it's kind of like a chicken breast. Whenever you grab the chicken breast out of the freezer and it's hard as a rock. As it starts to thaw, it gets a little more pliable, and then when it's completely thawed, you can slap it on the table, you can flop it around, do all kind of things, and that's actually compared to having blood in your muscles. Whenever it starts to first thaw, it's kind of how your muscles are. They don't have that full range because it's not, fully engorged with all that blood, but when you really warm up and you really get that blood going through the muscle, it's kind of like that fully thawed chicken breast.
That's a great example. It really is. And it's the same tissue, it's just in a different state. And the same thing with your body. We are what we eat, and we are what we do on a day-to-day basis. And if we don't perform any type of moderate activity at all, we're going to start to see health problems. And once you have it, you really don't want to price cancer. You really don't. Not that you can guarantee you won't get these conditions, unfortunately. Lots of good people end up with unfortunate circumstances, but if it's by your own choice, by the lifestyle that you live, it's 100% preventable.
And what about like post-WOD? And I'm guilty of it too. A lot of us are, and we should probably teach this because I already know what you're going to say, but so we come in, we warm up, we stretch, we do our things, we do the WOD, we end up on the ground, we kind of get up, and a lot of us just kind of pick up our stuff and head out the door, mostly because, we got kids, we got soccer, we got just all these different things kind of gets in the way. However, in a perfect world, we have tons of time. What is the deal about cooling down, post-WOD stretching, mobility? What are your thoughts on that, and why should we do it?
The athletes, you're not going to see LeBron James with a hot pack on the sideline after a sprained knee. It's always RICE, rest, ice, compress, and elevate. That applies to most of your extremities. You can't always do that to your core as far as elevate or compress your neck. We don't recommend that. But as soon as you can get some ice, it can be just a bag of ice out of the freezer with a paper towel around it like we did as kids, or it can be some of these really nicer gel packs and such. But getting that inflammation out of the area is going to allow you to get back into action as soon as possible, whereas if it swells up, once the swelling is there, you might be out for 48 hours or 2 or 3 days, depending on how severe the inflammation is. But if you can rest it, throw that ice on it, the little compressive wrap, if it's, more than average uncomfortable or discomfort, I guess you should say, the ice will get you back into the activities quicker. We warm up before activity, we hit a cold shower or ice bath afterwards, and that's going to keep it from swelling up, because once the swelling's there, it's a lot harder to get rid of it. You got to keep it from happening, and that's what the compression and the ice do.
So kind of touching on that recovery, there's tons of different things that we can use, things that I've learned from you, things that I've actually learned from Ray, because Ray, believe it or not, knows some of his stuff, right?
Oh, yeah.
So lots of things that we do here: foam rolling, lacrosse balls, e-stem. Like what are the reasons that we do that? Why do we foam roll? Why do we lacrosse ball? And before I even get into that, Kelly Starrett, however you say his last name.
Okay.
He's a huge proponent of all this myofascial release and foam rolling and end of range mobility and stuff like that. But whenever you read his book or talk to him or see his videos, it's basically might as well be in Japanese.
It's like drinking water out of a fire extinguisher.
Yeah, it's preposterous. So kind of with that said in the beginning, if you talk about a little bit of this, let us.
The form that your muscles do in the skeleton is contract. They contract to close your elbow. They contract to open your elbow, whether it's a bicep or a tricep. And so when they don't let go all the way, that's where the Grafton, the foam rolling, the lacrosse balls, all of that stuff is wonderful to basically, like a rolling pin on like a pie crust. You're trying to get the knots out. You want to get a smooth consistency throughout the entire muscle. And some people may do it incorrectly, whereas they're trying to pop and crack things. And again, sometimes it feels good because there's less pressure in the joint when the gas is relieved out of it. But it cracks and it pops when it doesn't go into the right position as well. So that is not the end goal as far as what we try to educate people with. It's to get the muscles to go back to their original form. And dehydration, toxicity of car exhaust if you're stuck in traffic, all of these things can reside in our bodies. And foam rolling, stretching, any type of mobilization will help those spasms to alleviate and get you back to where you have 100% use of the muscle, which means you're back ready to perform again sooner. And you can get by without it if you're very lucky, and usually young. The older we get, the slower we heal. And so as we celebrate each decade on this earth, one thing is certain, and that's gravity. And so we have to take care of our bodies, because that's pretty much what 90% of your nervous system is for, is everything but pain. We think about pain because it gets to our consciousness, but rehabbing and recovery, if your brain can't talk to that part of your body, you'll see atrophy. If you ever put your arm in a cast, you pull it out, it's not looking like the other arm because you haven't used it. So if you don't use it, you lose it, and there's no better time to start than today.
Yeah, I know for sure. One thing for me is, you and I are pretty close in age, and I'm not one to really complain about my age. As a matter of fact, I just turned 40 this year, but I kind of welcome that because I'm like, man, I'm 40, I feel great. But one thing that is for sure is that I do not recover like I used to. Things kind of get banged up. I get sore, muscles hurt, and I've really come, thanks to you, to humble myself and keep myself in check and take my ego out of it, listen to my body, take rest days when I need, even though that I really want to get in the gym and do what I have to do. The other thing is that when I start to feel a little tight back or tight hamstrings or, whatever the case may be for me, I'll kind of go down the street to see you, just say, hey, look, on a scale of 1 to 10, I'm probably at about a 5 right now. I'm not feeling that great, so fix me up, and we'll kind of start to work on those things, and you'll give me some ideas to do at home where I can use my gua sha at home, or I have a little e-stem machine that I got that really kind of helps in preventing and my recovery. And I can tell you it's been a godsend for me, because if it wasn't for all that stuff, I don't know. I would just be hurting all the time.
And just as a synopsis, what we're talking about right here is physical health care. Everything that people do in here is physical. The e-stem is using electricity instead of chemicals to help to get you to sometimes distract you from the pain, sometimes actually alleviate the pain by getting your muscles to let go of their contraction. But again, the nutrition is the chemical choice of longevity. Nutrition. If you have a chronic situation where you want to see a change over a long period of time, doing it slow and steady wins the race. If you've ever heard of the tortoise and the hare, you can go and you can have surgery, you can take drugs and lose weight with them, but there's always a consequence from it. And if you do it the natural way, if you do it with the gua sha, you do it with the chiropractic, you do it with the exercise and nutrition, and you have a pretty healthy attitude as well. Sometimes we give attitude adjustments because the brain can create or destroy, and when you exercise, the brain creates. You feel better. You get a body image. You flex even when you maybe shouldn't.
Yeah. Another thing I kind of wanted to talk on is there's also lots of controversy about ice baths, whether it works, whether it doesn't work. I know you and I have had this discussion, so just kind of wanted to hear your thoughts on it. I know for me personally, I hate them because they hurt so damn bad, but when I get out of them, I feel amazing.
They feel great.
Especially if I'm run down, man, I get out of that thing, I'm just
It's
feel
a
like
love,
I'm ready to go.
It's a love-hate relationship.
Yeah.
I don't think I've ever met likes an ice bath, but it's a necessary evil, if you want to call it an evil. When you get really good results with it, it's hard to say evil, but it's definitely not pleasant while you're doing it. It's just if you are a repetitive athlete and you're going to be doing things several times a day or several times a week, you're going to get more out of it. You're going to get maybe 2 or 3 extra workouts because you've recovered. If you take a little bit of the uncomfortableness and you feel it, you know what it's doing to you. And again, muscle relaxers can chemically let your muscles untangle. But there's consequences with your organs. Versus ice, you feel what you're doing. You do not want to have frostbite, and that's impossible in an ice bath. But, there are people who just say, I don't want to feel that way, and you don't have to submerge yourself in a bathtub full of ice. You can use an ice pack. But if you put the entire circumference of the joint in the ice bath, it's more efficient. You get the recovery quicker, but you have to be willing to take it because it's not comfortable.
Yeah. So I know we kind of talked about a lot of stuff. One thing I want to bring up now is that people that are sore or hurt or kind of, they don't know anything about chiropractic, like, now what? What should be their first course of action?
Well, really just come in for a consultation and just see what we have to offer. We have instruments that don't even, barely put any type of force in at all, and then we gradually work up to what you're comfortable with. Some patients don't like to hear the noise. We have techniques that use inertia and drop tables and things like that, so we don't have to crack or pop you. That is not what makes you better, so it's not a necessary part of the treatment. But if you think that, let's just say, giving your child a drug to help them concentrate, or you give your child a drug to help them lose weight, or yourself, you think that it's more comfortable and it's safer than possibly using any other types of discipline or nutrition. But really, your organs don't always talk to you until they're failing. And so we just like to be conservative. We like to be on the wellness end of the spectrum. And nutrition, exercise, I just can't really say it enough. There's low risk. There's low risk with it. And it's not always what will get you better the fastest. It's what has the least amount of risk to hurt you. Because you can go into some radical procedures. We've had about 15% of our patients are post-surgery. And we help them with,
need help.
Yeah, we help them with scar tissue. I had 2 back surgeries yesterday that, they're 90% better, but we help them get that other 10%.
The one that I always remember you telling me about is how many times people that have had carpal tunnel surgery but still feel the pain, and they come see y'all, and a couple months later they're pain free, wondering if they should have ever had the surgery to begin with.
Well, that's a great point, Ray. A lot of times you point to where it hurts, and the problem's not always there. That's just where the nerve ends up. And, bilateral or carpal tunnel on both sides is pretty rare unless you're a pianist or someone that's, typing an incredible amount. It's an overuse injury. But if you think of your brain like a faucet on the side of a house and your nerves are like a garden hose, if you go to spray off your truck and it doesn't spray off, the problem may not be with the nozzle on the end of the hose. It may be the kink upstream. And so you go find the interference with the water flow, you take the kink out, and now the nozzle works again. You might have thought it was a faulty nozzle, and it may have been upstream. And that's where chiropractic, we're going upstream a lot of the times to your spine and to your central nervous system to take care of a lot of the problems in the periphery or in your arms and legs. Neuropathy, we do great results with that, whether it's diabetes or whether it's a pinched nerve. If your nerves aren't there, you're not there. That's the difference between paralysis and getting out of this chair at the end of this podcast, is we can talk to our legs with our mind and we can get up. And that's the severe type of injury that you can have in the spine other than death. But the spine is where your quality of life is. And so it's of utmost importance to slow down the process of arthritis, because if you live long enough, you're going to get some form of it. It's just gravity. But if you're in symmetry, just like the front end of your car, you don't need tires as often if you have an alignment. You're going to perform better in here if you have an alignment, and that's what we want to offer as far as nutritional advice as well.
Yeah, that's a great analogy. I like that. So I've been on all sorts of different ends of the spectrum, working through soreness. I'm kind of hurt, but I can still do the WOD. This pain isn't going away, but I'm hard-headed, so I'm just going to do it anyway. I'm hurt, so I'll just avoid certain movements. And that really touches on a lot of the athletes here as well. And for them, I would just suggest, like you said, it's low-risk treatment. So if any of those describes you or your thought process throughout the day and you haven't gone see a chiropractor, I 100% suggest that you go and see Derek and Angel, DNA Chiropractic. It's right down the road from our box, about to be next door.
In-house.
If you don't know, ask one of us. Again, that's DNA Chiropractic.
Well, thank you guys for having me.
Lifesavers for us. So come and see us. Come and see Derek and Angel, and we'll take care of you, get you on the right path, educate you, and let you know how to take care of things your own way. A little bit of that prehab, as Ray talked about.
And the last thing I'd like to say, Eric,
Yes.
And again, thank you guys for having me, is if you're intimidated, just come and watch. I'm sure there's people here that would let you watch them. I've got patients that would let you watch how we treat them. And just try to form, your opinion from the knowledge that you have on the subject instead of what you've heard. Because, again, most of the people that are really negative towards either this or that are uneducated. It's just really the safest thing you can do for yourself is, try to put the riskier things into the next decade, because you may end up needing drugs, you may end up needing surgery, but we're going to try to prolong that, both of us. That's what we do.
Absolutely.
Yep, so come on in, come see us, come see Derek and Angel at DNA Chiropractic, and we appreciate you guys being here, and all that you do for us, and we appreciate y'all listening to our show. So that's it, and until next episode, we'll see y'all later.
Well, thank you for having me.
Of course.
Sir.